Today's RSAU University educational opportunity is about tips and tricks. Let's learn more.
We all know that navigating your healthcare and insurance can be tricky, so we have compiled a few benefit plan tips and tricks for you. Utilizing your benefits and accessing healthcare services have become more and more complex, not to mention expensive over the years. These tips and tricks are meant to provide you with tools to get the most bang for your buck out of your benefit plans. Just as importantly, know that there are options for accessing care for many of your healthcare needs. The most important thing is learn your benefit details. Ask your provider, ask your Rose Street Advisors benefits team. We can help make sure that you are understanding the benefits that you have and know that you are your own best advocate for your benefits. So always work with your provider, but make sure that you are doing what's in the best interest for your care. We always recommend that you wait for your explanation of benefits before paying an invoice from your doctor or provider. So you can always match up and make sure that the service that they're billing for is being billed for what the carrier is saying that you owe. I've had people overpaid their services because they were billed a little too early. And then it can be difficult to get your reimbursement back from the provider. Okay, utilize, excuse me, your healthcare provider services that they offer, such as the MyChart, which a lot of the hospitals and doctors use to communicate. So go on there, ask questions, request prescription refills, or request a referral if that's required. Not all carriers require referrals, but some specialists do require referrals, so you need to get that from your doctor. You can also request to order lab work. I like to do this every year at my physical because I know my doctor is going to order lab work prior to, or once I have my physical. So I like to get it done prior so that we can go over the results when I'm there, because, you know, they send them to me, but I like them to tell to me what it is in English. So use the cost estimator tools for health services and shop around for cost and quality. Most carriers have a tool right on their website that you can look up, and they might have incentives to going for a high quality, lower cost provider. And usually those go hand in hand. They want the providers to have high quality because that in turn means less follow-up, that less care after, but at a lower cost. So you can pay less for the services, knowing that you're getting great quality care, and some of them offer incentives. I've received a gift card for utilizing one of the higher quality, lower cost providers. And it was for one of my preventative services that was covered 100% by my insurance. But since I used a higher quality, lower cost, I save money, they save money. And so they helped reimburse it in the form of a gift card. Avoid using the emergency room in non-emergent conditions. I see this all the time. I formerly worked in an emergency room department, and a lot of stuff came in that was so not an emergency. So, but yes, it's there for use for an emergency. But if it's not an emergency, try utilizing an urgent care. Try utilizing virtual visit or telehealth visits. Most carriers provide that. Sometimes your doctor's office will have virtual visits available. I've seen that with a lot of the doctor's offices, especially since the pandemic went through. Utilize walk-in clinics. So I know in our area, we have several of those around here. Sometimes they're also very similar to the urgent care, but you can walk in and get care without having to have an appointment. And also contact your nurse line. Most insurance carriers have a nurse line available. It's usually available 24/7. So you can contact a nurse and ask questions. I would say this is for more minor things, but definitely is an option out there. And one other thing I would like to mention is I always recommend utilizing what I call freestanding labs and physical or occupational therapy centers, ones that are not hospital based. I have found over and over again that the charges tend to be lower at these facilities. A lot of times they go towards your deductible and coinsurance on your insurance plans. And so if you go to one that has lower costs, you're going to pay lower out of pocket yourself. Prescription drugs. So make sure that you shop around for prescription drug prices. A lot of times it's not going to matter if you have a flat dollar copay. But even if you have flat dollar copays, sometimes the medicine might be less than your copay. Say you have a $10 copay on generics and the drug costs $4.79. That's what you're going to be charged. Well, another pharmacy might charge $3.25, so just definitely check around for prices. You can look up estimated costs on your insurance carrier's website. You can also use services such as GoodRx to research the cost of your drugs at various pharmacies. So I know both my insurance carrier as well as GoodRx. I just put in the location and the name of the medication, the strength, and it gives me a cost. So definitely utilize that. I always recommend to people also is if your doctor's going to be ordering you a new medication, I have the app on my phone for my carrier, and I look up that medication to see, number one, is it covered? Because the doctors don't know the formularies. So number one, is it covered? Number two, how much is it going to cost? So I can, talk to my provider before I actually leave the office. Another thing to do is utilize mail order services for maintenance drugs. You can usually get a 90-day supply at a discount. You can usually get it for lower copays, or you can get wholesale pricing. So I've had a high deductible health plan where I could get my prescription at the pharmacy, or if I went through the mail order, I got wholesale pricing, and it actually was less than picking it up at a pharmacy by a good little chunk. So try generics of brand name drugs. A lot of generics come out every year. Most carriers require you to utilize the brand or the generic if it's available, but definitely work with your doctor to get on the best medication for what's going to work for you. Okay. And then there's always the option of exploring purchasing prescriptions outside of your insurance coverage. Think cost plus drugs. Most people, I always think of it as the Mark Cuban plan, or trying over-the-counter treatments. The one negative about this is it's not going to go towards your out-of-pocket maximum that most plans have. But if you're one that's not utilizing a lot of services, getting those lower cost prescriptions might definitely be worth it for you. And then finally, research coupons and rebates available from pharmaceutical companies. So I generally will Google the name of the brand name medication, go to the manufacturer's website, and see if they have any discount programs out there. I have helped some of the employees that I work with do this search, and sometimes it's a little bit, sometimes it's a lot. I had somebody tell me they were saving $200 a month going through that program through the manufacturer's website. So definitely look into that. I will let you know that some of those coupons and rebates are for a limited time. So definitely look at that as well, because if it's something that you're going to be on for quite some time and the coupon's only available for 6 months, you sort of need to plan ahead that after 6 months, you're still going to be on that medication. You're not going to get that discount available. Okay, so just caution on that. When you're utilizing dental services, most dental plans have a network. A lot of the ones that we use, you have the same benefits in or out of network. But if you go to somebody who participates in the network, you'll get a higher discount. And you won't be balance billed over reasonable and customary. So I'll give you an example of that. You go and get your teeth cleaned. I'm just going to throw out easy numbers. $100 is what the dentist bills. Maybe your insurance carrier say we're going to approve and pay 90 because it's 100% benefit for your preventative on the plan that you have. For example, we're going to approve and pay 90. Well, your dentist is not going to balance bill you that other $10 because that's a discount and they're going to write that off. But if you went to somebody who does not participate with the dental network, they are going to bill you that $10. And if they do not participate in the network, there's a chance that they're going to require you to pay in full up front and then wait to get reimbursement from your dental carrier. So then you're spending money and you're waiting a couple weeks to get that reimbursement. A lot of them will courtesy submit, but sometimes they even require you to submit to the dental carrier yourself. So caution on that. Okay, and then also use cost estimator tools. Some of the dental carriers have that out there. The other thing that I recommend is that if you are going to have something done that's other than your routine cleaning, your bite ring x-rays, things like that, have the dentist send in a pre-treatment estimate for the services. Usually they recommend this on services that are going to be $300 or more. But that way you are going to know before you have the services done what your out-of-pocket costs are going to be for that service. If you need vision services, make sure that you stay in network. You're going to have lower copays and out-of-pocket costs in network. There is coverage out of network as well, but usually it's quite a bit lower than if you were to use an in-network vision provider. Pre-tax accounts are also something that your employer might offer. So some employers offer high deductible health plans that you pair with a health savings account. So you can put money into that health savings account on a pre-tax basis. Or they might offer a flexible spending account where you can use the medical and dependent care. You're also putting money into that account on a pre-tax basis. So what that does is lowers your overall taxable income, and that's where you're seeing the savings. So it definitely can be significant, especially if you're putting a good chunk into those plans. Okay. And then make sure that you're finding out from your carriers what perks are available. Some of the plans, usually this is on the disability plans, have an employee assistance program. A lot of the medical carriers have discounts for gym memberships, fitness equipment, vacation rentals, rental cars, things like that. Some of them have health classes, things like that. So definitely look into that as well. Travel assistance I've seen on some medical and on some life and disability carriers as well. Or will prep. That is something that is available a lot of times through those life and disability carriers as well. So, if you don't have a will already set, sometimes it's a good starting point. You get something out there. Things we don't like to think about, but are necessary. Okay. I want to thank you for your time. If you have any questions about benefits, tips, and tricks, or you want to learn more, please contact your Rose Street Advisors relationship manager, or contact, if you don't know who that is, contact info@rosestreetadvisors.com, or contact our main line at 269-552-3200, and they can get you to the right person that can help. I always recommend that if you have questions, contact us here at Rose Street Advisors. We have seen a lot over the years, and we definitely, if we don't have answers, we can find them for you. So appreciate it. Thank you.